Hi, everyone. On today's episode of Women Talk, we're going to be discussing breast cancer and previvors, people who are at higher risk of cancer. We're going to be focusing on the different ways to approach previvorship. We're also going to be hearing the unique perspective of breast cancer survivors and previvors and what helped them through their journey. Today, we are joined by expert guests and members of our Women's Health Advisory Council, Dr. Lisa Larkin. Dr. Larkin is a women's health internist and now the founder and CEO of Ms. Medicine, a women's health company that is dedicated to advancing evidence-based, gender-specific primary care. Dr. Larkin, it's so great to see you, and thank you for joining us on Women Talk.
Thank you so much. It's great to see you too, and it's great to be here. Thank you for all you do for women, Beth.
Thank you. And I am so honored to have Jenny Wyckoff, a friend of Healthy Women and a patient advocate and a previvor. Jenny, it's so great to see you. Welcome to Women Talk.
Thank you, Beth, and thank you for what you and the organization do. It's awesome.
So today we're going to be learning a little bit more about genetic testing and screening measures to better understand your risk and your options. So thank you for joining us on Women Talk, and now we're going to get started. Dr. Larkin, I'm going to kick it off with you. Can you help our audience understand what is a previvor?
So first of all, a previvor is really a term that's not a scientific term, but it describes a category of individuals who are at elevated risk of developing cancer. Most of the time, that's because of carrying what we call a hereditary cancer mutation that puts them at elevated risk. So these are individuals who are aware that they're at elevated risk of developing certain specific cancers, but have not experienced cancer yet, or hopefully ever.
Thank you for that. And Jenny, I know your story, but I would love for you to share with our audience your story and how did you determine that genetic testing was right for you?
Yeah, thank you, Beth. Well, I feel like I kind of didn't determine it, but I was lucky enough to have a very special aunt, my Aunt Laura, push me to get tested after she found out that her mother had the BRCA/BRCA2 mutation. And when she first told me, it was around 2015, 2016, and testing wasn't super prevalent. It wasn't the norm. It wasn't necessarily covered at the time by insurance. And so I mentioned it to my doctor, the mutations on my paternal side. And at the time it was kind of like, let's wait a beat. And so I had my children. I continued to see the same gynecologist. And once I had my children, my aunt came back to me and said, okay, so how about now? How about now? And I was like, okay, I will go get tested just to make sure that I don't have it and we can stop this conversation. And so I mentioned it to my gynecologist again. She said, yes, now's the time. And what we found is it can be on your maternal or paternal side equally. So it was really helpful to be at that point in time. And I did the blood test. Simple, no big deal. I did it at my local hospital. And at the time, I was living and working in New York City in my 30s. And I remember it was a Friday afternoon in August. And I was standing on the subway platform, ready to go home. We had summer Fridays, so we got off early. It was very nice, ready to go home in the middle of the day. And I get a call. And it's the genetic counselor at the hospital where I had my test. And she said, hey, I wanted to let you know we got the test results back and you're positive for the mutation. And I'd like to schedule an appointment to bring you in and talk about it. So that was that. I hung up with her. I called my sister. We were both in shock because in having those conversations with my aunt and knowing a little bit about the mutation at that point, we knew what it meant to get that result. So not a good weekend. I got the call on a Friday. It was not a good weekend. I still can't decide if I would rather get it on a Friday and have the weekend to decompress, or get it during the week and not have my weekend ruined. But I was very lucky. Both of my parents came with me to meet with the genetics counselor. And she sat down and talked to us about what it meant, the risks, the numbers, what I would want to think about in terms of next steps. And I just sat there, and I remember so clearly, and this was 2016, so clearly, I was like, oh, this is how I felt. This is how I'm going to die. I just got handed a piece of paper that's telling me how I'm going to die, and I'm 36 years old. Okay. And so that's the question was about my genetic testing, and that's how it kind of came about. And then coming out of that meeting, we started talking about what next steps would look like, and all the information that we got, and my head was in a swirl.
I can imagine. I can only imagine. And what were some of the, do you mind sharing, like, what were some of the options at that point? What was she sharing?
Absolutely. The options included, but were not limited to, preventatively taking tamoxifen, preventive surgeries, obviously all screenings and testing to make sure that I didn't have any cancer yet. That was super important. Right. And then deciding if ongoing screening was going to be an option I chose for the elevated risk of cancer in the breasts and ovaries, or if I was going to do ongoing screenings or elective surgery. So that's kind of what I was sitting with, a whole bunch of different options and information. And the first thing I needed to do was obviously get more information, and then start to get all of the screenings and testings to see where I was at that moment in time.
Do you mind if I jump in and just say two things that I think from your story to really highlight? The first thing is just for listeners to remember that, you really should know your family history. And when it comes to breast and ovarian cancer, knowing your family history on your paternal side, your father's side, is equally important to knowing it on your mother's side, because these mutations are passed from either father or mother. And you have a 50-50 chance of, if either one of your parents has a mutation, of you getting that mutation. And so, in healthcare, we often don't, visits are often very fast with your primary care doctor or your gynecologist. And a lot of times family history is not addressed on a regular basis or thought about, just because it's, you're there for a specific problem. And so just for listeners to really make sure that you know your family history, and if you've got a family history of cancer, that you're bringing that to the attention of your clinician and really kind of advocating for this discussion about whether or not you need genetic testing. The second thing I would just say is, and it's so important, and I'm sure that getting the, the original, finding out that you carry a mutation is devastating in some ways, in a lot of ways, right? But the good news is, right, knowledge is power. And what I believe it has set you up for is, right, great preventative care, so that this is not the way that you die, right?
Yes.
And really important. And the last thing I'll just say is, for listeners, now remember, I say to all of my patients, the biggest risk of having breast cancer is being female and having breasts. I'm a breast cancer survivor as well. I'm now 8 years out. And at the time I was, just turning 50. Actually, I guess I'm getting to 9 years now, just turning 50. And no family history at all. So the population risk of developing breast cancer is that 1 in 8 or 12% that women hear. But the reason we want to identify these mutation carriers and that women should advocate for themselves is because the risk is so much higher, right? So we say it's really 45 to 75% lifetime risk for a BRCA mutation carrier for breast cancer, right? So we want to know about that because of all the things that you're going to talk about, Jenny, that you did to reduce your risk, because it is, compared to population risk, so much higher.
Thank you, Dr. Larkin. And what you just said is such an important point. And I'm so relieved and proud to be sitting here having done the testing, because of course that was my initial reaction when I got handed that piece of paper with the results. But I will always choose life. I'm choosing to live, and I am choosing to address this in advance. So I feel like, well, quite frankly, I have thanked my aunt for saving my life. So I will always choose this because I want to live, and I'm going to do so in an empowered and informed way.
So I'm going to go on to the next question. And Dr. Larkin, you started teasing out some of the information already, but can you tell us, where that conversation begins? Like, which healthcare provider do you actually start with if you are diagnosed with breast cancer and are considering a surgery?
You mean diagnosed with a mutation or diagnosed with breast cancer?
I would say let's talk about the mutation, because we'll tease that out from Jenny's experience.
Yeah. So, this is really one of the reasons that I do what I do in practice, right? Because what I would tell you is that women's health and women fall through the cracks in this arena. This is going to tie into your question of which provider should you be seeing, right?
Right.
So what I would say is, women's health doesn't belong to one specialty. The best care for women is integration of kind of gynecology, OB, and then primary care, because you need to take care of women across the lifespan. What often happens in medicine is that when women, are 35 or 38 and they're done childbearing, right? So they're not seeing their OB very much anymore. They tend not to have so many visits with the OB. They haven't really developed enough medical problems to start seeing the primary care doctor very much, right? So there's very few points of medical contact. And then when women do see their doctors, it's usually for a sinus infection or a UTI, or it's their pap smear, and they're in and out very quickly. And so these really important conversations about family history and whether or not you could be at risk for carrying a hereditary cancer mutation just really doesn't happen. And what we know is that, Jenny, you actually found out about your mutation at exactly the time when you needed to find out about it, right? Because where I always have a hard time and feel terrible is when I'm identifying a mutation carrier at the time that she has a diagnosis with breast or ovarian cancer, when it's already they're a cancer survivor. So what happens is, women fall through the cracks. And so in this age of 35 to 50, women need to be their best advocate. And I don't think it's one specialty. I think it can be your gynecologist, or it can be an informed primary care provider. Again, not all primary care providers are very in tune with women's health or the women's health genetic space. And so it can be there, or it can be you have a family history and you can kind of self-refer yourself to a high-risk clinic or a genetics clinic to kind of get tested. But there isn't one answer to that question, right? Because again, this is really what I would say one of the problems in our healthcare delivery system for women.
No, I couldn't agree more on that. But I wanted to also talk a little bit about elective surgery options that are out there for those of us that may have higher risks of breast cancer. Can you talk a little bit about that?
And I'm sorry, I kind of stopped after that. So So if you have a mutation, right? So one of the things that you will learn from the genetic counselor and your physicians is, you do have either one of these BRCA1 or BRCA2 mutations, an elevated risk of breast or ovarian cancer. What the next step is that a woman will take really has to be thought about in the whole context of her age, where she is in relation to childbearing, where she is in how close she is to menopause, and which mutation you actually carry. Because if a woman is found to have a mutation and she hasn't had children yet, right? Or she is not sure if she's completely done and we're trying to buy some time, right? There's all kinds of things that we can do with medication, for example. So Jenny mentioned tamoxifen to reduce breast cancer risk, but oral contraceptives are also a very good way to reduce ovarian cancer risk. So again, in these younger women, there are things that you can do initially in addition to enhanced screening, right? So we're very careful to make sure that if you're at high risk, that you would be detected, your breast cancer would be detected very early. So this is usually mammography and breast MRI every year. But again, so that's for the younger woman who's not really ready to have, big surgery here. Right. And then in women who are beyond childbearing, the options then do become surgical. So because it's both ovarian cancer risk and breast cancer risk, there's really now obviously taking your ovaries out to reduce breast cancer risk. And I'm going to come back to that, and whether or not you would have surgery to have mastectomies to reduce your breast cancer risk. Now, because we don't have as good screening for ovarian cancer, and ovarian cancer is obviously a bad actor, rapidly growing, that's something that really, I think, often is the first thing that we really talk about. And so now there's some data out there about taking out just your ovarian tubes, because most of ovarian cancer starts in the tubes. And the reason for that is because we would like to try to figure out a way to safely delay menopause in these 30-year-old women, because there's unintended consequences of that. So for the ovarian cancer risk reduction, sometimes it's taking out the tubes first and waiting a year or two with screening to take out the ovaries, or until you're done, a little closer to menopause. And then for breast cancer risk reduction, certainly having bilateral mastectomies is the surgical option. There certainly are approaches and physicians that would say taking tamoxifen, because 5 years of tamoxifen does reduce risk by about 50%. And because we have really good screening for breast cancer, that again, not having bilateral mastectomies and managing it a different way is certainly an option that is discussed with patients. But what I've seen in practice is the majority of my patients will opt to have bilateral mastectomies for risk reduction as well.
Thank you so much for sharing that important information. And Jenny, I know your story, but I was wondering if you could share with us how you came to your decision to have surgery, and how was your experience with surgery? And the second part of the question is, if you had to do it all over again, would you do anything differently?
Okay. So Dr. Larkin, I feel like I'm learning some new things from you. So I'm really excited to hear how you're talking about it. It's different from how I heard it back in 2016 and then 2017 as I started my surgery journey. One thing that does align with what you said, and I'm grateful to have known about it at the time, were those early studies that showed that perhaps ovarian cancer started in I heard you call them ovarian tubes. I've known them as fallopian
tubes. Yes. Yeah. I mean,
so,
the tubes and the fimbriae.
So how did I get to the surgery part? Well, I had finished my childbearing. I had two little boys at the time, 2 and 4. And I was looking to not just screen to make sure I didn't have something or eventually wouldn't get something, but really take the more drastic measures of surgery to make sure that I wouldn't have to deal with cancer if I did get it. So in addition to thinking about the surgery, I did go on birth control, oral contraceptives, as you said, to help with ovarian risk. I did change my diet and focused on getting healthy and exercise and really thinking about the things that I could proactively do that were easy like that. But in terms of ongoing screenings, my choice was to take a thoughtful approach to preventive surgeries. And by thoughtful, I mean, I met with a number of different doctors. I got second opinions and really thought through what my path would look like that would be best for me and my body and reducing my risk as much as possible. So as you had mentioned, I went ahead with getting the salpingectomy, getting my tubes removed as part of that, preventing early onset menopause and hopefully reducing my risk. I also joined a study at the time that tracks women who go through this. I have the BRCA2 mutation. So my doctor had recommended, and I believe the recommendation is still getting your ovaries out before 45 or by 45. So that's something that I am working towards. In the meantime, I am doing screenings on my ovaries. So it's a combination of screenings and then surgery at the right time. So I had my salpingectomy, which was a comparatively easy surgery. It was done laparoscopically. The recovery was fairly okay. I had worked really hard to be in my best physical shape and get my heart ready for surgery with lots of cardio in advance. That was something I had read about and did. And recovery was okay. My husband was super supportive, and that really helped. And my parents were incredibly supportive. My sister and my best friend, they were all there helping with the kids, and my aunt, and taking shifts and things like that while I recovered. And then thinking ahead to the breast surgery, it was really, I knew that I wanted to do it. It was also really scary. It was both of those things. And I can speak about the journey matter-of-factly now, but at the time, it's so complicated because it's emotion plus being healthy and choosing to have the surgery, the emotion from getting the test back, being empowered and being scared, and then having to do the research and the work to build your team. My father really helped so very much when it came to building the team. He did a ton of research around doctors in my area, the insurance they took, the specialties. I also started going to support group, which I can talk about a little bit later. And that made a big difference too, for not only getting recommendations, but dealing with both the practical and the emotional side of that journey. And so once I started to really get my team together, which took a long time, it took a lot of appointments. It took a lot of research on my part and realizing that the doctors may be an expert in one thing, but I had to kind of learn as I went about what those things were so that I could make the best decisions for myself. But I found a team that I trusted, and my next step was going through the double mastectomy, preventive. And I had that scheduled. I rescheduled it a few times. It was really, knock on wood, my choice. I wasn't driven by a cancer diagnosis, although I will tell you, and this is hard, I feel like this is like not great to say, but there were times in this emotional frenzy where I almost wish that I had that kind of diagnosis, even though I regret saying that now, because the decision would have been made for me, right? Choosing to do this with healthy breasts was really hard and scary. Even though I knew that it was the right decision for me, it wasn't easy. So once I had my date down and all of my pre-testing done, and my husband there holding my hand through all the pre-tests, and just, again, taking yourself down this medical journey without a cancer diagnosis does take a lot out of you, but it's also really important and powerful. And I would take my children's picture with me everywhere so that anyone I interacted with, like on the medical staff, could see why I was doing it. And it helped me feel strong. My date came. I had a great team that I trusted, and I came out of surgery, and I did have an overnight in the hospital, and the nurses were great. The teams were great. Everyone took care of me. And I can talk a little bit about recovery if we're ready to hear that and go there at this time, or we can pivot a little bit.
No, we can talk about recovery. And because I just think, again, the things that you're saying are so important for our audience to hear, and the importance of a team approach, right? Because I feel for so many of us that we feel like we have to take this on ourselves and just like shut everyone out. And I think hearing your story and how it was your friends and your family and the team approach with your healthcare professionals and the team approach with the nursing care after surgery is just it's so important. It's so important for all of us to hear. So thank you for sharing that. But could you talk a little bit about recovery? Do you mind?
Not at all. I just want to mention that I know that some folks don't have families and friends who are as supportive as mine were, and I'm very lucky. I did also find a lot of support through going to the support groups. Some of them are in person, some of them are virtual. that made all the difference. So if you don't have your people in your personal team, you can find those people, and and a lot of these support groups will connect you with a patient who's been through it. So that's a huge gift.
So important. It is a
So
gift.
important. Yeah. Okay, so where am I? I'm
Recovering.
in the hospital. I'm recovering.
With your tubes coming home, I'm sure, right?
Yes.
Yes.
Yes. The salpingectomy, getting my tubes out, that was outpatient surgery, in and out, recovered at home. The mastectomy, the double mastectomy, I had read the reconstruction handbook, and hopefully we can put the link in the chat. It was really, really helpful and talked me through the different kinds of reconstruction. If I wanted to have reconstruction,
Right.
some people choose not to, which is also 100% fine.
Right.
So the path that I had chosen was based on my doctor's recommendation, and the research that I had done was double mastectomy to expanders, which were placed under my muscles, and then I would eventually swap those out for implants.
Right.
So at this point, it's April. I had my double mastectomy. I was in the hospital overnight. I was on medication. The nurses were watching me. All was well. I got to go home, and I had set up my bed and my pillows. Some people have recliners. There are all different ways that you can set up for recovery, and there's tons written about it. And a lot of it was having my personal team together. And so that was not only my doctors and the follow-up, but also my family and my childcare and the help that I would need, because recovering from a mastectomy is pretty intense. And I was lucky to find out that my pathology was clean. And so I was able to really focus on just the physical and mental recovery of the experience. I did have a hiccup in that journey. I have come to think of this a little bit as a art and not a pure science, which I did not have that perspective going in, but it's not just you get it done and everything is fine. Your body may react in certain ways. There are things that you might not expect. For me, it was going in on the Thursday morning, 1 week after I was released from the hospital, and going into my plastic surgeon's office to check how things were going. They were bandaged up. I hadn't really looked. I did have, what are those called when you have the tubes?
Drains.
Thank you. I did have drains to help
Right.
make sure that the fluid left my body. I will tell you, as a non-medical person, they were gross, but they're fine. They don't hurt. It's not a big deal. Mine were healthy, and it's fine. It's just visually surprising, but they were fine. And so I went to have my drains removed and my bandages removed. Getting the drains out, also fine. Felt weird. Does not hurt. But then the doctors took off the bandages. And I still remember this noise. They said, "Oh." I was like, what do you mean, "Oh"? And what it was that my tissue was really dark. And what that could have meant or could mean at the time was that I could experience some tissue necrosis or death of the tissue. And I was already in an emotional state, right? This is a big thing to go through. It was really scary. And I still, all these years later, that was 2018, it's 2023 now. That was definitely my darkest night at home. I remember it really well. And I will say, for everyone listening, it's really important to not only have your personal and medical team, but if you need mental help too, that's a really important part of the team that you can build. There are amazing therapists and support groups that work with this kind of thing. So it was a dark night. It was really hard. And I woke up in the morning and I was like, okay, what can I do? Because that's really important to me. I'm very type A. What can I do? And so I called my plastic surgeon's office and I talked to the nurse practitioner, who is amazing and has been such a part of my journey. And I said, look, what can I do? Tell me what to do and I'll do whatever it is. So she gave me a list of vitamins, things to eat that could help promote healing. And then we started talking about wound treatment. And I ended up going to a local hospital that had a wound center, and they checked me out and were able to get me additional treatments that might help my wounds. So that was really amazing. And I am very, very grateful to say that quite a few months later, I finally went back to my plastic surgeon for like a final check. They were like, okay, we're ready to move on to the next step. Your skin is pink and healthy. And so that was amazing. And I could continue on that journey that I'd planned out for myself. So from there, it was the surgery to get out the expanders. From there, they started expanding the expanders for the first time, which means injecting liquid into them little by little to make a pocket for the implant. It does not hurt when you get the injections. The muscles take a little bit of time to adjust, but it doesn't hurt. The expanders themselves are not comfortable. And so in a few months, when it was time for me to have the exchange surgery, putting in the implants to replace the expanders, I was so excited. Outpatient surgery. I woke up so excited because at that point you just like feel so good to have the expanders out and the implants in. And then from there, I had a number of additional follow-up appointments with the plastic surgeon to see how it was looking, how it was healing. I had a revision surgery, which is, in and out same day. You get very used to it, and it feels very doable at that point in one's journey. And then I had some fat grafting, which is taking fat from it was from my thighs. It's different for different people. And some people don't need it at all. Some people don't want it at all. This was the journey that I had. My plastic surgeon recommended that I have fat injected into where the implants were on top to help with the cosmetic look. And I opted for that. And that was a little bit of a longer healing, but again, in and out in one day. And I would do that all over again. And to go back to the second part of your question, Beth, would I do it over again? Would I make the same decisions? 100%, 100% and then some. And I can confidently say now, a number of years later, I look in the mirror and it's just, that's my body. I'm going about my life, fairly normally. And I'm so grateful that I elected to have the surgery, and I would make the same choice again, 100%.
That's an amazing story.
It's a great story. It's such a great story. And thank you for sharing all the steps. How long was it from the day of surgery to the day of like your, the implants? Like, what was that timeline like? Was it a year?
It was within the same year. So I had all the surgeries that I just named within the same year.
Wow.
And it sounds like it's kind of mind-blowing, but you get used to it. Like, before I had started this journey, I'm like, the breast option with the least amount of surgeries possible. But then once you get into it, you realize like this is just part of the journey. Not everybody has. I think I had 5 in that year. Not everybody has that, for sure. Some people have 1 and done.
Right.
But it all depends on the choices that you make for your body type, your goals, all of those things. One thing that I forgot to mention that's such an important part of this whole thing and the whole team, physical therapy became a really important thing for me in my recovery from the mastectomy. I wasn't able to have full range of movement with my arms coming out because it affected my muscles, not in a negative way, just in adjusting to the expanders. And so there was a physical therapist at my local hospital who specialized in breast surgery patients. Right. And it was I said the word gift before, it was such a gift to have her be able to touch and massage and stretch in ways that really helped my very particular situation. And at some of my dark times, it was really a gift that helped bring some light to the situation. So I highly recommend that if you have access to that.
Great advice. And thank you for sharing that, because sometimes I think we forget about the different components of recovery, right? So the physical therapy is that's such good advice. Your advice to previvors, Jenny, what is your advice to others that are listening out there right now? What would you say?
When you first get the information, you may be scared, you may be angry, but I promise as you work your way through the process, it gets better. As you build your team and figure out your path, it gets better. And there are others that are here, whether you know them already or not, that can help you in your journey and can help you get through this. And it is worth it. You have been given a gift of information that you can choose to determine where your life goes.
Thank you. So now we're going to go to some of the questions from our audience. So if we have a loved one going through the process of finding out that they are a previvor, how would we best support them? Dr. Larkin, what would your thoughts be on that?
Oh, I think that's a better question for Jenny. I mean, you've done such a beautiful job with your story, just talking about building the team and the importance of kind of family and friend support. I think that obviously is so critical, but I don't know if you have anything more to add, Jenny.
I would say, thinking about the support, whether it's your friends, your family, medical, all the above, mental health. But then also I had mentioned a few times the support groups. I went to FORCE, which is, I believe, Facing Our Risk of Hereditary Cancer. I went to their support groups in person. Over the pandemic, I went virtually. It was very, very helpful. Through the Share Charette organization, I was paired with a patient who had been through the journey. And they also paired me with a genetics counselor because I felt like even though I had excellent care and information from the genetics counselor I met with originally, as a patient trying to process all the information, I wanted to ask the same questions all over again. I wanted to get that information again and just double check before I went on my journey. So they do a lot of wonderful things. There are a lot of books. There are a number of Facebook groups which can be very helpful. But I also found that a lot of them have people in challenging parts of their journey. So if you're new to the journey, it can be scary. So there are times when you may have to find your information, but then choose to filter for yourself, depending on where you are with that. I will say that if you are a friend or a family member of somebody who does have the BRCA mutation, offering to go with them. My best friend came with me to FORCE support group meetings, and it meant so much to me. And I think about that still. My husband came with me many times, and it was really helpful to have him informed as part of the journey and to hear what others had gone through and to get the advice of others in the group as well. So wherever you can bring friends and family along, I would say if they're supportive, do so. And if they're not supportive, then you make decisions about where you're going to find your support.
That's such great information because I know so many people want to help and they just don't know how, friends and family members. So I think I love that. I love being able to bring them in and that you found that so helpful. Thank you for sharing that.
And also I will say, if you're lucky enough to have an amazing sister like I do, she came in and played mommy to my kids while I was recovering. So those types of things. My aunt, my mother, and my father, they were all kind of taking turns with that, helping out my husband at that time.
So lucky. You're so lucky.
Yes.
So if you find out you have the BRCA2 gene mutation, what's the first step you should take? Who wants to answer that one?
I'll start. I would say take a deep breath because I think, Jenny, you did a great job of kind of talking about the journey through feeling different ways about having that information, right? Obviously, it's terrifying at first, but again, what I really stress to patients, and I do a lot of genetic testing in my practice, is that knowledge is power, and that really knowing, there are so many things that we can do to prevent you from developing cancer, and that this information is so important for you as an individual, but also for your children, right? So like this is really something that you want to know. So what I hope is after you take that deep breath, you feel terrified, that you get to the place of feeling empowered and really building your team. You did such a beautiful job describing that. I think that's really, really important as well, because it isn't, to your point, and what I talked about before, is how we have healthcare is very siloed in this country, right? And so an individual physician is not going to be enough for this situation. You really do need to build a care team, and it does take time to do that. And I would tell you, even as a breast cancer survivor and a physician who works in this space, right, you will see that even as part of your care team, sometimes you get a little bit of different information, and it's said in a different way. Yes. And there is, particularly with hereditary mutation carriers, individuals like you, Jenny, there's a lot of what we call shared decision making. So it's a lot of taking in the information from your team, which may not always 100% exactly mesh, and then really kind of understanding where you're at, both from your age and reproductive factors, but also in your head, like what really, and I think you described that very, very well. So this is really important. The team and having this relationship to do shared decision making is really, really important for all hereditary cancer mutations. The last thing I'll say in closing, because I know we're kind of running short on time, is just that, Jenny, you didn't talk about it much, but when you get to the place of having your oophorectomy and you are menopausal, right, that brings a whole host of new discussions with different doctors about the appropriateness of hormone therapy, about sexual dysfunction related to menopause. There's just lots of other things. And so what I always really encourage, for my breast cancer survivors, but also for my previvors like you, is, again, you need probably a slightly different care team, but that you should not just feel lucky to be alive, which is that there's lots of things we can do to navigate all of these other journeys for you, if you find the right care team. And what I also encourage women is, we don't want to miss the forest for the trees, which is that you're very focused right now, of course, on breast and ovarian cancer, but you're going to live a long, healthy life. And we need to make sure that we're focusing on bone health and brain health and cardiovascular health and sexual health and quality of life. There's just a lot of other things that as you go forward, you need to have a really good care team in place.
I'm going to end on that. That was perfect. Thank you so much for joining us today for another conversation on Women Talk. And don't forget to join us for our next episode of Women Talk. And thank you so much to my guests for taking the time out of your busy schedule, Dr. Larkin and Jenny. Thank you so much for sharing your expertise and your stories with us. We'll see you next time on Helping Women's Women Talk.
Thank you so much.